So the first area I want to chat about is not so much about facial aging, but it's about my expertise using liquid injectable silicone for nasal rejuvenation and non-surgical rhinoplasty. So non-surgical rhinoplasty is utilizing injectable fillers in the nose to change the shape of the nose, and my expertise is in using Silicone 1000 or liquid injectable silicone in the nose. So what kind of problems can I deal with? If you have a small bump on the bridge of your nose, that can be camouflaged. I can raise the height of your nasal bridge and straighten a crooked appearance. Some of the most rewarding experience I've had are correction of rhinoplasty irregularities, mostly from other rhinoplasty surgeons. Things that I can improve upon without a revision rhinoplasty surgery is a pinched or an overly narrowed tip. Retracted nostrils that are too high with too much nostril show can be improved non-surgically, and restoration of symmetry. In general, 3 treatments are necessary for a desired result. This is very rewarding for me, and for patients that can have a no downtime office procedure as an alternative to revision rhinoplasty surgery, this can at times be a blessing. And as I'll show later on in the presentation, noses that are large, long, with droopy bulbous tips, adding volume into the nose is not going to be helpful, and these are patients that would be candidates for nose job surgery. So the first example is a patient of a 16-year-old boy who's tall, he's handsome, he has a nice strong chin, chin projection, and he has a relatively short nose. So in my view, to remove the bump is going to be a mistake. It's going to feminize his nose, and it's going to give him a curved profile. So utilizing 2 treatments, I injected silicone above the bump and below the bump, and you can see that he's got a nice, natural-looking, straight appearance. Can you guys appreciate the after views? Are the after views looking okay? Okay. This is a female patient recently that when I saw him, I remembered her. A little bit of a smaller bump. Again, not a nose that's too big, a nose that's proportional for an otherwise attractive face. She's concerned about the bump. Doc, what can you do about the bump? So on 3 occasions, I filled in a little bit of silicone above the bump, a little bit after, and a little bit below rather, and this straight nasal profile is completely permanent with no downtime. This is an example of correcting a curved appearance. This patient had a trauma to the nose, and you can see that there's a C shape with a maximal indentation over here. This is immediately after 1 treatment where I filled in this area on the nose. It makes the width of the nose a little bit wider over there, but in general, a nose that's a little bit wider but straight is less distracting and more pleasing to look at than a nose that's crooked. This is one of my Canadian patients. This is immediately after a second procedure because I knew I wasn't going to see him again. Very, very happy patient. This is after a previous nose job that was performed in Canada. And there's a lot of stigma on his nose that say rhinoplasty surgery. He's got asymmetrical tip cartilages where the left tip cartilage bulges out more than the right. He's got a crooked appearance on the left side of the bridge. And he's got deep creases above the nostrils. I should have mentioned earlier, everything I'm showing from now till the end of the talk, on the left side is before and the right side is after the treatment. So you can see after the second appearance, he's got a much more normal appearing nose. I added some volume to the tip to make it a little bit wider and less pinched. It's more natural looking, and I corrected the curvature that used to exist on the left side of the bridge. When you look at his 3/4 view, this is what's called a saddle nose deformity. His nose resembles the saddle on an old bicycle where it's curved like that. You can see some visible operated looking tip cartilages that are unattractive and a deep crease above the nostril. This has been filled, the bridge has been filled in, and the unnatural appearing nasal tip cartilages, which are known as basae, have been improved. And then on the profile view, his curved appearance has been straightened, and he's left with a more masculine, natural-looking, unoperated appearance. This is just a close-up view to demonstrate what I can do after rhinoplasty on somebody who has what I call retracted nostrils. So a lot of patients complain, I have too much nostril show, doc. When people are looking at me, they're looking right into my nostrils. There's also asymmetry of the tip cartilages, as in the previous case, and a slight indentation in the bridge. This gentleman had his we did about 4 procedures over the course of a year, and you could see a much more normal, natural-looking nose with less nostril show and a straighter appearance. This lady is a patient that I did recently this year who popped into my mind. Beautiful woman, very operated looking tip, bad nose job, asymmetrical tip cartilage, as I call this, a pinch tip, where the tip is just overly narrowed, unnatural looking, and by getting some volume in there or getting a buffer of silicone in between the skin and the underlying cartilage, it leads to a softer, natural, less operated appearance. We also did 1 treatment with liquid injectable silicone to her lips.